I'm a pediatric endocrinologist here at BC Children's, which is a doctor who cares for children and youth with hormone related conditions. One of the most common ones would be diabetes. Type 2 diabetes, for example, was unheard of in children 30 years ago. There was no cases of type 2 diabetes in children in the world. We're seeing increasing cases of type 2 diabetes in young people, and many of those young people are children. So it was very clear that it was unhealthy lifestyles that were driving the development of this disease in young children. And so children in general are playing differently, they're eating differently, and they're spending a lot more time on screens. And all of this has resulted in increasing rates of chronic disease. My area of focus and where my passion lies is really, well, what can we do before that happens? So in the work that I do, we keep it fairly simple, right? We use this message called Live 5210. 5 means at least 5 vegetables and fruits a day. 2 is less than 2 hours of screen time. 1 is at least 1 hour of active play, and 0 is 0 sugary drinks. The approach should always be around promoting healthy behaviors and teaching young people what is healthy, what is unhealthy, and giving them the developmentally appropriate information that would help them to make that connection. And the belief within the pediatric world is talking about dieting does not help children and youth. Children and youth are changing, they're growing, their bodies are going through puberty, they need the right amount of calories. And so you'll see even through the Live 5210 initiative that I lead, the 5, the 2, the 1, the 0, each one of those is a health behavior. We don't talk about weight. We don't talk about losing weight. And so it's really important that that concept is understood across all sectors so that it's consistent, whether it be in the health sector, the school sector, the recreation sector. So the messaging is there as a bit of a campaign. The message is easy to remember. It's goal-oriented, right? So whether you use it in a recreation center or you use it in a classroom or I use it in my clinic, I can help a child focus on a behavior that they want to focus on. And our nutrition is also very much linked to our mental health. So there's very good studies, particularly in adults, but I think we can very much translate this into children, that certain nutrients or types of diets, like the Mediterranean diet, are linked to better mental health outcomes, whether it be decreased depressive symptoms, etc. And so it's such a fascinating time right now, I think, in the world, where we're really starting to understand how these different parts of us interact. As gatekeepers of children, it's our responsibility to set them up on the right path as soon as possible. And when I mean as soon as possible, I mean early childhood. 1, 2 years old, we need to start setting the right example. We need to start showing them what's healthy and what's not healthy. But most importantly, we need to give them the opportunities. And if we want to give them the opportunities, we need to change our policies. We need to change our environments. And we need to have it front of mind when we're making decisions about programming, curriculum, etc. Right? And I see that happening in this province. So to me, that's probably the most hopeful thing I've seen over the last 10 years here.